Brizzi, as has already been mentioned, and thank you very much for allowing me to be here. What we wanted to present to you is part of the Fowler registry that has been presented by Dr. Lázaro, but we wanted to present a sub-analysis linked to patients older than 65 years of age who come to ER. As has been previously mentioned, one of, all falls have very negative consequences for health, and functional deterioration or impairment is one of the most important ones. And for the public health services, this is, of course, an objective to try and prevent functional impairment or deterioration, because as part of the global strategy to promote health, we have noted that falls are one of the main causes of disability amongst this age group. And we need to, of course, manage chronic patients following strategies that will increase their health, but also we will try to prevent lesions and diseases precisely because of this. So the goal of this project is to assess changes in functional changes that arise from a fall and the prognosis factors associated to the functional impairment at 180 days. Functional impairment has been evaluated following the Barthel Index, which is a score that's used in geriatrics to assess the functional independence, considering 10 items which are part of the basic activities of anyone's daily life, such as, for instance, eating, grooming, commuting, based on a scale from 0 to 100. Those who receive a higher punctuation or a higher score are considered to be independent compared to those that are at the lower part of the scale, which are considered dependent. And of course, we analyze the baseline situation, the situation a month before the fall, at the moment of the fall, and after discharge. And of course, over the telephone, we did a follow-up. At 30, 90, and 180 days after the fall, so that 6 months after we could determine what the functional impact the fall had had. We took into account several variables that are portrayed in the literature that can establish a relationship with functional deterioration, things that have to do with the baseline situation, such as age, sex, living alone, comorbidity, baseline functional status, previous falls in the past year, polypharmacy, cognitive impairment, and depression. And there were other variables, such as, for instance, things related to the acute fall episode, like, for instance, etiology of the fall, extrinsic, intrinsic, or unidentified, whether there were fractures or hospitalizations related to the fall, the use of sedative drugs during discharge or at discharge, and the fear of falling again, and whether a series of recommendations had been given to these patients, recommendations regarding the prevention of falls. Now, the variable that we mentioned in the result was cognitive functional impairment relative to IB change. And also, we took into account the baseline situation, and we did a comparison based on the percentage. And we also talked about the loss of function in those patients who had lost more than 10 absolute points in the Barthel Index. We performed statistical analysis with the program SPS, and we used the ANOVA test to perform several measurements to determine the scores, the Barthel scores, at several points in time. And we did a logistical analysis to determine which variables could have an impact on functional impairment at 180 days. Out of the 1,600 patients in the Fowler registry, in the sub-analysis, we included 452 because we excluded one hospital facility that didn't perform follow-up, and the patients who had passed away in those 6 months, and we included those that could report themselves or a caretaker, so that we could indeed perform the follow-up on their functional situation at the follow-up times. And even though this is a smaller sample, it's representative of the follow-up cohort. We're talking about the elderly people. In majority, they're women. Half of them had a certain degree of functional dependency, high load of the disease, chronic treatments. 64% of falls were extrinsic, 30%, actually 28% of them presented fractures, and they needed hospitalization. As you can see here on the graph to the right, you have the absolute values, and to the left, the relative values. And you can observe that all measures compared to the baseline situation, which is the first point in all graphs, show that at discharge, the patient presented significant functional impairment, and this functional impairment is ongoing and persistent across all points of the follow-up. And when we analyze what percentage of patients had this functional impairment at 180 days, which is clinically relevant, we determined that 133 patients presented this, 30% of them had a functional impairment. Now, in the next graphs, I'm going to attempt to show out of the different variables that we analyzed, which ones were considered to be related and therefore could be considered prognosis factors for functional impairment. Age group is very important. Patients elderly, older than 85 years of age are a group that's especially vulnerable, and we see that they do present worst functional results. Sex was not a prognosis factor, and the baseline situation was not a prognosis factor. Irrespective of the situation, the baseline situation, they presented functional impairment at 6 months, and chronic diseases and not treatments, but previous falls were a risk marker for functional impairment, just like cognitive impairment. And regarding data correlated with falls, we can see that intrinsic falls that can be perhaps because of medical causes or because of things that the patients didn't correct. These were linked to worst functional outcomes, and also the most serious falls also led to fractures and led to hospitalization. These were considered very important risk factors, as well as the fear of falling again. And this is the odds analysis. Here you can see that being older than 85 is significant. The presence of fractures, hospitalization, and postcranial syndrome. And with this, we can say that conclusions, in the conclusions that patients older than 65, when they fall, they suffer consistent, persistent negative impact on their functional status. And there are several factors that are linked to this, like, for instance, the severity of the fall and the fear of falling, which are correlated with this. We would need to conduct further studies to determine whether, once we have identified this population, we could establish measures in preventions to help us perform rehabilitation on these patients so that they could recover their function. But as previously mentioned, this is secondary prevention or tertiary prevention. But we consider that there are many falls that have happened because of causes that could potentially be prevented, and this is what brings us here, because we really think that you can help us prevent these initial falls and the important consequences that come about with it. Thank you.